One of the biggest advances in the fight against lung cancer for decades.
If it hadn't been picked up with a CT scan, I probably wouldn't be talking to you now.
Back in the 60s, Roy Wallace worked in Wittenoom's asbestos mill.
The actual asbestos was being treated at the time and bagged and this type of thing, and it couldn't be helped that there was asbestos dust in the air all the time.
Each year, 6,000 tonnes of refined fibre leave Australia's only blue asbestos field. But the immensity of the known deposits ensure a long and prosperous future.
Of course, the reality is opposite.
When you look back, it was, and you know what you know now, you wouldn't have gone near the place.
Like thousands of other West Aussies who've been exposed, Roy gets a yearly checkup through Charlie Gardner's asbestos review program.
I think I can recall the words from the doctor was, do you want the good news first or the bad news?
The bad news, Roy had lung cancer. The good news,
he said, if you have to have lung cancer, he said it's the time to get it. So we can do something about it. It's been caught early.
Last year, more than 11,000 Australians will have been diagnosed with lung cancer.
It's the world's leading cause of cancer death, and certain groups are more at risk. People exposed to asbestos are twice as likely to get lung cancer. Smokers, 10 times. Smokers exposed to asbestos up to 20 times. Head of the Asbestos Review Program, Dr Fraser Brims, says traditional ways of picking up lung cancer need improving.
The problem with lung cancer in Australia and many other Western countries is that about 8 out of 10 present at a time where the cancer's too advanced and too late to offer curative treatment.
But in an Australian first, the program has started using old technology in a new way, and for people like Roy, it's literally life-saving.
We can offer low-dose CT scans, which are the same radiation dose as a plain old-fashioned chest X-ray, and yet they offer almost an infinite amount more information.
So Fraser, what are we looking at here?
So we've got 2 CT scans here, and this is a chest CT scan, and this irregular area here, this sort of whitish area, is in fact quite a large lung cancer. But this, I'm afraid, is at a stage that we can offer some treatments, but not anything curative. By contrast, this is the scan of one of the ladies within our asbestos review program, and this tiny area here, which is only about 9 or 10 millimetres, is in fact a very early lung cancer.
Usually, 8 out of 10 lung cancer patients are diagnosed too late to cure. It's hoped this technology can flip that statistic on its head.
The really exciting news is we've picked up 10 lung cancers in our group of people, none of whom had any symptoms or any signs that they had this.
All 10 have had surgery, and so far, it's 10 out of 10.
We can now potentially significantly change someone's life at a time when they didn't know they had potentially lethal illness.
Have they saved your life?
Yes, definitely, definitely.